Well, hi, everyone. Mary Key, founder of the Key Women's Leadership Forum. For those of you that are listening to this recording after, welcome, everyone. I want to thank Sarah Connolly. She's a longtime member of our Key Women's Leadership Forum for coming forward and saying, hey, I think this is an important topic and I'd like to share it. Sarah serves as a fractional general counsel to growing healthcare businesses that need a lawyer on their team, but in some situations don't need a full-time in-house person. She's worked in this role with everything from PE-backed companies with lucrative exits to founder-owned businesses with long-term successes. Sarah's passionate about presenting and training on important trending legal topics, including most recently reopening responsibility in the COVID pandemic. She's working closely with those on the front lines fighting this virus, including healthcare providers, state and local epidemiologists, and even directly with the CDC. So we have an excellent source here. Today, Sarah will teach us the valuable lessons we've learned over the last year, and some of which we didn't know or have not been aware of, and tell us what we can expect this year and beyond. Thank you, Sarah.
Mary, thank you so much for having me, and to all of you for joining today. It is wonderful to see your smiling faces. I can't wait for the day. The extrovert in me cannot wait for the day until we can all be together again. But I'm so glad that you've taken the time out today to join me. I've been getting so many questions, but I've really gotten a crash course in COVID working with my senior living clients, assisted living, skilled nursing, where we've really been on the front lines of battling this virus and working directly with state and local officials, and even with the CDC back and forth on some mass testing and PPE. For our purposes today, got some great feedback from you guys already, so thank you for sharing. We'll focus quite a bit on employees, so messaging, safety, questions around vaccines. May or may not surprise this group that vaccine adoption rates are actually pretty low. 50% and below is the estimate of vaccines adoption rates for frontline healthcare providers. So that may surprise you. It did me, but I've been spending the last few months spending a lot of time in vaccine training and education. So I heard from you all that that's something you want to talk about. We'll make sure to spend some time on that. I have several things I want to touch on, but I love when a group is this size because we can really engage. I won't spend more time on the stuff that's not really resonating, but I'm happy to answer questions and spend some more time on the things that you really want to know about. So I'll make sure that I leave some time towards the end. Mary's going to help me and make sure we're monitoring questions in the chat. But please feel free, do not be shy. I see this as a great opportunity, my platform, to share what I know and really download for you guys. Because we've been living this thing together for the last almost year. Can you believe it? That we're at almost the 1-year anniversary of the pandemic being declared. There are a lot of things that you've learned along the way, but there is breaking news all the time, including I was just reading some news in the last couple of days about some of the new variants that we've detected here in Florida. So my big picture comment to you all is please don't be shy, because I want this to be as useful as possible for you. And I've probably been asked the question before, so if I don't know it, I can certainly point you in the right direction, but it's likely that it's come up at some point in the last year. One thing I won't spend a lot of time on, and Erin's on the call, we have some great employment lawyers that can help you navigate things like paid leave, some of the more nuances around employee legal issues. But by and large, a lot of those expired at the end of last year. You can still, if you elect to continue leave, you can still get payroll credits through the end of March. But for the most part, really switching gears now to what about from here forward, right? So without further ado, I will jump in. And again, please feel free to ask questions or follow up for anything that's really resonating. And with that, Mary, I'm going to go ahead and share my slides.
Great.
All right. Can everybody see my smiling face there? Yes, I'm seeing nods.
That's an awesome photo, by the way.
Well, thank you very much. I appreciate that. So today we're going to cover, these are kind of high level topics. We're going to talk about vaccine safety and how you get one. We're going to talk about what to do if an employee tests positive or you suspect is come into contact with COVID. How do I prepare to travel as safely as possible? And then of course, the big $1 million question, which is what's next and when will things be back to normal? Well, I can't read the tea leaves with certainty. We have a lot of good data, and our data has gotten smarter over time, where we actually do think we've got a pretty good idea of when and where the light at the end of the tunnel is. So I'll share that with you today. So one thing that I'd like to start with the really good news. I think we're all used to the bad news, and even with cases decreasing, we know we're not yet out of the woods yet. We still have high infection rates and a lot of folks in the hospital, and we've passed the 500,000 deceased Americans. We've hit that threshold, which is really, really devastating. All that said, the vaccine is a really, really exciting new piece of technology. And what I mean is this vaccine is based on the Reader's Digest version. It's a snippet of RNA that mimics COVID. It is not COVID. It's not, can't get you sick with COVID, but it mimics the protein that prompts your body to create antibodies that are effective in combating COVID. So it basically tricks your body into building up its own immune response. And unlike vaccines historically, and it might surprise you to know that a flu vaccine is only about 40 to 60% effective year over year because the virus changes so often. The efficacy rates of the COVID vaccines are in the 94 to 95% range, which is very, very high and very exciting for the future of epidemiology. The other thing that's really cool about this technology is that it is able to be adapted relatively quickly. So we'll talk more about these emerging variants and some of the concerning news around that, but know that this technology is more readily adaptable. And since we've gotten through this first round of FDA approvals, that we should be able to fast track, even in the event that the virus or the vaccine does need to be changed to address some of these new strains that have emerged. So that is great, great news for the scientific community, that it's only going to get better from here. Now, there's a lot of talk of herd immunity because that's really when we as a country and as a globe have reached the point of having enough immunity amongst us that the vaccine does not continue to be transmitted. In other words, that's when we have combated this virus to the extent that we can get back to, I would define herd immunity as the normal, right? Back to normal. And it's not an exact science. They're estimating somewhere in the neighborhood of 65 to 85, or more likely 70 to 80% of the population will need to have been vaccinated or been infected with COVID-19 in order for us to achieve herd immunity. Now, for comparison, here in the state of Florida, we have just shy of 20% of the population vaccinated. So we are not there yet. We are still a few months out from being to that point. But with the Biden administration's promise of 300 million 600 million doses or 300 million individuals being vaccinated by this summer. While that has been slow to ramp up for a few different reasons, delays in production, recently weather affecting shipping, and candidly, just a lack of leadership and coordination among federal and state and local governments, but it is getting much better. And we're really starting to see vaccines go in arms and the rollouts go more smoothly, and production or vaccination catching up with production. Right now, we're at about 85% of the available vaccines have been given to people, which for a while we were struggling in actually getting those rolled out. Great questions around safety of the vaccine. And this is what I've been kind of shouting from the rooftops here over the past few weeks, that the vaccines have very, very low instances of severe side effects. Meaning you'll see some of the news around anaphylaxis, which is a serious allergic reaction. The instances of that are very, very, very low. So out of the many, now millions of folks that have gotten the vaccine, anaphylaxis has really only been observed in people who have already had serious allergic reactions, many of them EpiPen users, folks that are aware of allergies that may impact your ability to take this vaccine. So certainly talk to your physician if you've had allergic reactions like that before, but the likelihood of you having a fatal or serious reaction to the vaccine is very low. Now, to prepare yourself and your employees and your family members, they will likely experience side effects, although typically mild to moderate and resolving in 24 to 48 hours. So that does take some planning ahead. The most common side effect is injection site pain, low-grade fever. If you're pregnant, take a Tylenol to keep your temperature down, some body aches and chills. But again, that should resolve. You know, you go to sleep, wake up feeling good the next morning. At most, you may want to plan to take the day off the next day if you do anticipate or experience some more of those symptoms. But rest assured that it is very, very safe, and everything other than this really cool new mRNA technology, everything else that's in the vaccine is commonly used ingredients, and they're safely eliminated from your body. So I know there's concerns about how quickly the approval of these vaccines was fast-tracked. It went through rigorous testing. Think about all of the thousands upon thousands of our best and brightest focused on this pandemic and saving people and protecting people. They did get this technology right, and the testing was extremely thorough. Now, I do understand the fears, and in particular, I got a great question from a client and a friend the other day around fertility. While there have been about 10,000 pregnant women part of vaccine trials, there's not been consistency in studying that or enough confidence to make kind of firm conclusions that it's safe for folks that are pregnant. However, they have not observed any instances of that having a negative impact on fertility. They don't expect that based on the technology either. In other words, there's nothing that's part of this vaccine that they expect or would see any connection with an impact on fertility for men or women. And as a matter of fact, they've said it is so much riskier to go without the vaccine and potentially expose yourself to COVID than it is to get the vaccine. So other than the cautionary tale for pregnant women to make sure they control fever that can have an impact on a fetus, they otherwise believe that it is safe for those that do have fertility concerns. Just COVID by the numbers here, we do expect by midsummer that the vaccine will be widely available, potentially a little bit earlier. Florida is getting 400,000, upwards of 400,000 doses this week. I've only seen a few, I think 8,000 was the number I saw in the last 48 hours coming here to Pinellas and Hillsborough, but that's because it usually takes a little while for them to message to the general public where and how those are going to be administered. So you may have seen Baycare did some vaccines, a couple rounds of vaccines, Publix, Walgreens. So make sure that you're keeping up with local news and social media. You know, unfortunately, there's not a one-stop shop of where to find this information, but really keeping your finger on the pulse. Certainly follow me on LinkedIn or social, because I push this stuff out to try to update folks, because it's really breaking news and those appointments go really quickly. If you've tried to call or schedule those online, you know that those appointments can be hard to come by. So make sure you're proactively keeping an eye out. Another thing that's been very clear in the guidance from Fauci and the CDC is even after you're vaccinated, you still need to take all of the same precautions that we've been taking to date. Social distancing, wearing masks, hand hygiene often, avoiding crowds, staying in well-ventilated areas, all of those things we've been doing since the outset, because we don't yet know whether once you're vaccinated or you've recovered from COVID-19, you still may be able to transmit it to others, and you still may be able to transmit it to folks who are at risk or maybe haven't been vaccinated yet. So while you yourself may not become ill or become seriously ill, you may still infect others. So the guidance is very clear that we need to continue to take all of those steps, even after you've been vaccinated. We're also just learning how long natural immunity, meaning when you get COVID and recover, how long that lasts. We know it's about 90 days, but hopefully longer. And early indicators of the vaccine is that vaccine immunity lasts longer and is stronger. So a misconception that it's kind of one or the other, or that they're mutually exclusive. The guidance is really everybody should get the vaccine as long as it's not, a medical issue that would prevent you from doing so, and continue to take all of the precautions that we've been doing until now.
Sarah, a quick question about that.
Sure.
Are people who have had COVID that are beyond the 90 days, are you aware of any cases where people have gotten it twice?
Yes, they are few and far between, but there are documented cases of reinfection. Yes. There's also, and we are developing or starting to understand how long it takes for your body to build up its antibodies. They estimate about 2 weeks. So even if you've had your second dose of the vaccine, there's still another 2 weeks after that you're building up enough immunity to combat the virus. I have had the very unfortunate situation of having vaccines done at a senior living community and then having another outbreak within the 2 weeks after being vaccinated. So that's very, very important. And certainly when your team members are asking questions about, well, if others have gotten vaccinated or most people are getting vaccinated, the reality is this is a very, very transmittable virus. And when we're all in this together, we all need to be taking the vaccine, and we all need to be taking all of these. No, that was I've already done way too much of the talking. I know that was a dense slide. Any questions on that? All right, I will keep moving then. Common myths.
Well, actually, there is in the chat box.
Let me see here.
I'll read it to you, Sarah. It's okay. Yeah, no, you're the presenter. You take your. Just listen. Okay, is the 20% in Florida only those vaccinated? Does that include those that have already been infected? If not, what is the current total Florida percentage?
Great question. I don't know the answer to that, and I will follow up with you. That 20%, and it was actually 18 and change just a few days ago. So I'm hopeful that it's a little bit higher now, but that was just for vaccinated folks. Did not capture those who may have been infected and recovered. Candidly, what we're going to see, this is my prediction here, is that the virus is a lot more widespread than we know. And the variants that we're now detecting are more widespread than we know. I know that sounds like bad news. It's certainly not good news, but I think there are more folks that have some natural immunity than we suspected, and the viruses and these variants are more widespread than we thought. The big picture takeaway from that is we should all be getting vaccinated as quickly as we can for the strain that we know it's effective on, and it will still be very effective on the other variants, even if somewhat less so. Similar to a flu vaccine, close, even if it's not exactly right.
And Sarah, before you go on, another question.
Sure.
When is the vaccine going to be distributed to people under 65?
Good question. No official word on that yet. The order of priorities will be from that 65 and over, also those who are severely immunocompromised. So for medical conditions that make you more susceptible to COVID-19, there is a list on the My Florida vaccine, which is linked later. You don't have to write that down, but you can kind of pre-screen or find out if you're eligible based on a medical condition, even if you're under the age of 65. Order of priority from there is going to be essential workers. So we have healthcare, direct care staff, teachers are being included in that for moms on the call. That's crucial that we get our schools are safe to be in and that we have vaccines there. And then they will be available to the general public. So hard to pin down exactly when, but those essential employees and workers are going to be this next wave, and then likely by the summer for the general. Anything else? Okay. Common myths, like I said, it does not affect your DNA. It doesn't have active COVID. You cannot get COVID from the vaccine. We did talk about ways that you can contract COVID in spite of having been vaccinated. And once I get the shot, it's back to normal. We talked about Fauci being very clear that we need to continue all safety precautions in spite of the vaccine initiatives. Talking a little bit more about the variants, there's really 3 that have been identified so far. You'll hear them referred to in shorthand as UK, Brazil, or Brazil, Japan, and South Africa. What's emerging about these, and this is not a surprise to virologists, coronaviruses have been around a long time. They can cause things like the common cold. We're very familiar in how they function and what they do. It's just that this one's particularly nasty, particularly transmittable, and particularly deadly, but we're actually really familiar with how these work. And back to what I was saying about the vaccine technology, early indicators are showing that all 3 of those are more highly transmittable than the original strain. So that does mean, again, all of those same precautions in place, and that we need to be, looking for potential waves and surge capacity for our healthcare facilities. That said, only the UK variant has some indicator that it may be slightly more deadly, meaning a slightly higher mortality rate. But I don't want the takeaway to be that vaccines don't work or that we're already so far behind the 8 ball. The reality is that if I had to predict now, this isn't going to be a one and done type of thing, meaning this first round of vaccines is not going to be perfect, where now COVID-19 is eradicated. It's more likely that we'll have to deal with some of these one-off strains, especially the ones that are more transmittable, that may take an adjustment to the vaccine, a booster shot, if you will, in future years.
So there's a question here. Would
Sure.
love to hear about whether employers can/should require vaccination. I think that's
Yes, that's an excellent question, and I deal with it later in the presentation, but
okay.
it's a good time to talk about it. As a matter of fact, I think it's coming right up here. The answer is yes, you can mandate vaccines as an employer, with the exception of medical reason they can't, right? Like an allergy or a religious objection. So if you've heard the term reasonable accommodation and interactive dialogue, you have to have a conversation with the employee about why they're objecting to taking the vaccine. But only for those two exceptions, you can say the vaccine is mandatory, otherwise you can't work here. That can result in discipline and termination. The question, and the trickier question, is should you? And I'm working through this with my healthcare provider clients now, where that really ends up being a twofold question. One, from a culture perspective and employee attrition. Providers are already suffering from burnout. There's a lot of reasons why they're fearful or have hesitation or think they don't need to get the vaccine. So certainly spending a lot of time on training, safety, incentives, cash incentives, PTO. There's a lot of things you can do short of mandating that can get folks to agree to take the vaccine. But I'm not seeing and I think last I checked, I'm working with clients in 20 or 21 states. I've not seen anywhere that has them so widely available that mandating them is really, practically speaking, possible yet. When the vaccine becomes more widespread, certainly, and as we get concerning news about things like variants and low adoption rates of vaccines, I certainly understand why we're thinking that way, but practically speaking, it's easier said than done, right? So I hate to give the wishy-washy lawyer answer. The black and white legal answer is you can, with those two exceptions, but is that the step to take? That's really a culture question, and be careful about how that impacts your staffing.
Sarah, I just wanted to add the one interesting thing that I've been seeing in the media is that in other countries, like I believe it's Sweden and several others, or Israel, when you have your card that says you had been vaccinated, that allows you to go places. And some people are saying that as soon as more people are vaccinated, that may be a requirement of traveling abroad. So for those of you and in people that work in your organizations that feel, I know I feel like I'm missing out on some of the travel that I'd like to do. And I know from many of your scorecards, and Jen Hall and Laura Scott both report too that what's your highest wish for yourself in the next 3 to 5 years? That traveling piece has gotten put on hold. And so that may be the other thing, that there will be some cruises, some tours, other things that people could take that would require that card. So is that true?
Yes, that's another way that people will be naturally incentivized, is they can't travel without it. And that is the current state of the union right now, is that most places either won't permit travel from areas with high rates of infection, which the US certainly qualifies, or that they require proof of a negative test from an approved vendor. Be really careful about that because sometimes it's a very short list of approved vendors. That make sure you're checking your to and from destinations for any testing requirements and any quarantine requirements. I do know anecdotally have heard of a couple that was forced to quarantine in Hawaii because they didn't know they had to test hopping from one island to the other. Well, first world problems, it's nice to be in Hawaii, but if you were just told by the Hawaiian authorities that you need to quarantine for 10 days, that's a pretty rude awakening. So absolutely travel, that's going to be a big part of it. And I certainly understand why there's a lot of questions about that. Right now, that it's not quite widespread enough, I think, to really say, but yes, absolutely.
On the forefront, yeah.
Exactly. Talking about going back to school, back to work, return to normal. Schools, thankfully, kids have shown that they're very resilient. They're usually asymptomatic or very mild symptoms. Very rare cases of something called MIS-C, which is a multi-system inflammatory condition that kids suffer. Again, very small fraction of cases. But if you ever have trouble waking your child, not like they just don't like to get out of bed, but they really can't open their eyes, they have any bluish tinge to their skin, any difficulty breathing, I mean, you guys know you'd already have called 911. But those are the really serious symptoms to watch out for. By and large, your kids are, likely have been infected or will be and will never know. So that is the saving grace in all of this, is that our children have largely been spared. Do have your child get the flu vaccine. The vaccine has not been tested on children yet. Of course, for good reason. They want to be very careful about when and how they do that. I think it's probably a little bit unrealistic to think it happens by this fall semester. I hope so. If this vaccine program really ramps up, maybe that's possible. But still getting your other vaccines, flu vaccine, make sure you wait 2 weeks before getting a COVID vaccine and after. You don't want to take more than one vaccine within that 2-week period. And for returning to work, life, normal, knowing when to quarantine and when to come back out of it, CDC always gives us a little bit of a long-winded answer, but the good news is it's trending towards shorter periods of quarantine and shorter time periods that you're actually actively shedding virus and able to get others sick. So the current guidance is, if you're asymptomatic, you should quarantine for 10 days from the date of your positive test. If you have symptoms, it's 24 hours afebrile without fever, without the use of medication, and your other symptoms are improving. With the exception of loss of taste or smell, that's turned out to be an extremely common symptom that can last a very long time, unfortunately. So they don't consider that an indicator of active infection, but rather kind of a long hauler symptom, that loss of taste or smell. If you're severely immunocompromised or you had serious infection, you should wait 20 days. Your body takes a little bit longer to combat that virus to the point of not being contagious. And if you've had suspected contact with COVID, but you haven't been tested and you aren't exhibiting symptoms, the safest bet is 14 days from the date of that contact. 10 days at a minimum. The vast majority of symptoms develop in that time period and when you're most contagious, but 14 is the current guidance and is really your safest. They are saying that if you have been positive for COVID and recovered, or you've been fully vaccinated, meaning both shots in the last 90 days, and you have no symptoms, that you don't have to quarantine. So the indications are that when you've built up those antibodies, again, we still have to mask, social distance, take all of those precautions, but that you are not contagious and you're still better able to safely move around. No, that was a lot to digest. What I will do is pop that link. I'll share this slide presentation with Mary and put that link into the presentation that goes out. So you can always refer back to it. You don't have to take notes or remember.
Sarah, if you would, do you have more slides?
I do.
Okay, good, because I wanted to ask you about, for those that are employers or have employees, are there any other things besides what we've already discussed?
Sure. So I'll quickly hit on these travel items and then we'll talk about business owners, which I think is the next slide. You know, all of the steps that we take just moving out in public. Couple of things you might not think of. A lanyard for your mask is a great way to not have to touch the mask. Latest news from Fauci is double masking or masking with multiple layers of a filter is the way to go. So you might not have heard that. A surgical mask with a cloth mask over it is that much more effective. Bring snacks so you don't have to stop someplace that might not be safe for following protocols. Same thing with tissues, just be careful about your high touch areas. And I just read an article in the Atlantic this morning about domestic travel plans this summer really picking up. So people are scheduling domestic travel. We saw folks doing some more of that even last summer. So prepare for that. If you decide to go, just consider if you're at risk, you might want to delay. But taking all of these steps, and we're at the point now of eyes wide open, make those safe choices for yourself and your loved ones. But we're going to see travel really ramp up. And remember that generally speaking, you should quarantine for 7 days after returning home. That's CDC. Okay, so lot to unpack here, but I'll hit the high level and let you guys ask questions. Make sure if an employee tests positive, you are not to reveal their identity. That's considered HIPAA information. You can reveal enough facts so that other employees can figure out whether they've come into contact with somebody. Again, you try your best not to indicate who that person is. Sometimes you can figure it out, but from a infection control perspective, you have to give people enough information that they know to watch for symptoms or to go get tested. Knowing your state and federal immunity statutes, we don't have one here in Florida. There's some recent case law I'm still drilling down into out of California, and PrEP Act, which is not a recent act, it goes back a few years, but that it's possible that some of the federal immunity protections might apply elsewhere. That's still undecided law, but heading in the right direction. All that said, most immunity and waivers do not cover gross negligence or willful misconduct. Those are the legal standards. That basically means if you are taking proactive steps to protect your workplace and protect your team members, and you're generally following guidance, you're not going to be considered grossly negligent or willful misconduct. So do your very best. I know sometimes it feels overwhelming with conflicting news and changes day to day, but I don't want you losing sleep at night. Do what's best for you and your team, and do your best to follow this guidance. Check your insurance. Go ahead.
One of our clients, relating to that point, one of our clients has a big manufacturing facility in the Sarasota area, and he discovered one of his key managers was ill. The person continued to go to work. He'd been there a long time. People knew he was sick. There were some people that were vulnerable. He wound up firing the guy because the guy just kept working. Are there repercussions? Because even though he, as the owner of the business, wanted to do that the behavior of someone in a management role was such? Or is that again a gray area?
It's possible it's when you knew or should have known. So once he was on notice, needed to take the steps that it sounds like he did, which was to terminate that employee and ensure that others were safe. And some level of contact tracing should have been done at that point as well. So those are all things that will help you in defending a claim. I always say if it isn't documented, it didn't happen. So you really do need to save those communications to employees. You need to be tracking their leave requests. You need to be really diligent in following these. But if you do, you're likely going to be okay. All right. Make sure you're reflecting it in your board minutes. So for our business owners, not in detail, but that you're aware and following protocols, reflect those in your board minutes. If you're a healthcare provider, I don't think there are any on this call, but in your compliance and QA minutes, your insurance policies probably when they next come up for renewal are going to include a COVID exclusion. Maybe that's more my healthcare clients, but the insurance carriers, shame on them, have run for the hills and excluded this coverage rather than, continue to backstop their insureds. So make sure you know what your policies do and don't cover and have early dialogue with your brokers. You can't waive claims from employees, meaning you have workers' comp and OSHA regulations that you have to comply with. You can't have your employees sign a waiver of that. We talked about, yes, you can require employees to get vaccinated with those two exceptions I outlined. You can prohibit entry without a mask to anybody displaying symptoms, and you can take temperatures. Those are all established in the law. When the pandemic is over and when it's declared that it's no longer a state of emergency, you need to relax these standards again. But for now and for the foreseeable future, this is the legal framework we're living in.
Sarah, there are a few questions in the chat. One
Great.
is, where are the majority of your clients leaning when it comes to requiring vaccine?
I have only had one require it. And it's primarily because they're concerned about them leaving to work somewhere else, because right now staffing is a real concern in the healthcare industry, attracting and retaining good people, and the availability of vaccines. I do have a large client that is leaning and starting the employee messaging around, potentially making this mandatory when they're more widespread. I also see companies using it as a PR opportunity. There's a large senior living provider that I'll leave unnamed that has said it's mandatory, effective in August or September. Well, anything can change between now and then. And that to me feels like more like a PR stunt because people need to get vaccinated now, but every business has to make the right choice for them.
Well, it's interesting because in healthcare, for many healthcare facilities like hospitals have required their employees to get flu shots.
Yes.
And
And
so I
TB
was
testing and all kinds of, it's true that it's very well established that you can require those of healthcare staff. The gray area has arisen in this emergency use authorization and, the fact that these are new vaccines.
right.
All that said, many millions of people are getting vaccinated. We will have that data on any, unknown side effects. I'm the one out there saying, get on the train. Get on the train. We've tested it. We're tracking it. You need to get vaccinated.
Another question, what are the current requirements for self-reporting by employees? Even when signed waivers and agreements, are there any guidelines for this for employers?
Yes. So the only requirement, I don't believe that employees actually are required to tell you. Now, does that mean you may have a claim against them because they got others sick? Certainly, you could certainly terminate them for exposing others, but I'm only aware of the providers themselves doing the testing are the ones that have to report a positive of an individual. And then there are certain licensed, like senior living communities, hospitals that, they have to do that as part of their reporting. but it's really company policy that dictates. And Aaron or anybody else that may know that for certain, but that's not where the reporting requirement lies.
Feel free, other attorneys on the call, if you have any comments or insights.
No, I agree with you, Sarah. That is not where the reporting requirement lies. Yes.
Unfortunately, I mean, not the moral imperative, aside, right? We should all be very transparent about this. Removing the stigma, making it safe to talk about this with your HR department, with your leadership, leadership getting the vaccine and setting the example for others. I mean, there's a lot of culture things that you can do to encourage that. Certainly leave incentives is another way to monetize folks reporting that, but it's not something that is set in stone.
Cheryl, did you want to comment?
Yeah, I wanted to ask a question, and it probably goes to both Sarah and Aaron. I think one of the hardest ones that I've dealt with, especially with a lower wage population of employees, is that, they'll just say, I've been exposed to COVID, and then they want time off. So we had a doggy daycare client that magically, like 5 employees that wanted off over Christmas time period were suddenly exposed and had to quarantine. But then, she's like, can I ask them for proof of, that they've talked to a doctor, that they've taken a test? Of course, if you've been exposed, but you haven't, you're not going to test positive for it if you're just saying you've been exposed, so you need to quarantine. But I think that question of whether you can mandate that they have a doctor, that they actually went to a doctor and they told them they had to quarantine. So I was just curious what you all are seeing with this. Sticky.
Yes, great question, Cheryl. And generally speaking, you can require employees to send you correct paperwork, meaning from the provider and speaking directly to what your temporary disability is and when you'll be cleared to return to work. There was, in the midst of the worst times of COVID, directives that came out that said you can't require it.
Right, I remember that because it was so hard to get in to see a doctor.
Exactly, which made sense practically. Mm-hmm. That said, 2 things. This is just where my pragmatic mind comes in. As of December 31st of 20, you're no longer mandated under federal regs. Now, be careful about state level for those that have some locations outside of Florida. But this is where the hammer and figuring out the balance between the carrot and the stick, right? That you say that you're infected, you only have X amount of leave, right? And we'll give you what you're entitled to because this is what we, can do. But beyond that, we're not going to give you any special concessions. So yeah, Cheryl, it's a good question without an easy answer.
It's not a great answer. I know. I told him the same.
I know.
You can ask for it, but how do you prove that? I mean, they're going to get a note from a doctor. They can just say, oh, my girlfriend was exposed and now I'm exposed. And I mean, you can't disprove that, really.
Yeah. It's true.
Well, the good news is we're gonna stay on for a little bit. I know some of you have to leave and have started to leave because you have a hard stop in the hour. I want to thank Sarah and all of you for coming. I think it's been highly informative, and it's not ending yet. If you can stay on a little bit, Sarah's willing to do that.